Hey everyone, I'm Martell. This is Maria, and we're here with Sabrina. She's a BrownGirl RDH member who actually tested positive for the coronavirus, and she wanted to share with us her story as a dental hygienist being tested positive for COVID-19. So.
Hello, hi everyone. I wanted to share my story. I felt like I had an obligation to you all, my colleagues, that I got my results today. I tested last Monday, the 16th. I got my results today that I tested positive for the coronavirus, COVID-19. And I just wanted to, give you all some insight on, because I know everyone has a lot of questions. I had a lot of questions, but I just wanted to give you all some insight on how, when my symptoms started, etc. I've been sick now since March 5th. It started with the dry cough, just out of nowhere. I just had this really dry cough, and I started running a fever with the dry cough within 24 hours. So I pretty much just figured I had some sort of virus, whatever it was, I would just stay home and work on myself, self-medicate. Well, I didn't get better, and the symptoms continued. So I went to urgent care to be checked out. And I gave them my symptoms. I wasn't running a fever the day that I went to urgent care. And since I had not been out the country, they didn't make too big of a deal about it. They tested me for the flu, which came back negative. I was really surprised because my symptoms, I thought I had the flu.
So did you think, like, once you got sick and you had the fever, I mean, I know you said that was March 5th. Did you even think it was the coronavirus, or did you just think, oh, I just have the flu, or I might have?
The first day, March 5th, no. That was a Thursday, no big deal. Okay. But, I knew that I was coming down with something, because you don't just cough like that for no reason. Right. So worst case scenario, I thought, oh, like I told my mom, I'm coming down with some sort of virus, probably the flu. Within 48 hours of having cough, low-grade fever, at that time it probably was at 101. And, I thought I got the flu. The coronavirus at that time did not even cross my mind. Right. It wasn't until the following Wednesday, and I'm thinking, okay, I'm not getting better. I need to go. And my chest was hurting, what I thought was from coughing, which now I think was me having a hard time breathing, but I thought it was just from coughing so much. So when I went to the urgent care, again, they tested me for the flu. It came back negative. I'm like, well, what is wrong with me? And I had a chest x-ray because of the chest pain. The chest pain. So they sent me home, and they told me initially, we don't test at this time unless you've been out the country. And again, I didn't have any cause for concern, so I left. The doctor gave me some doxycycline because he said that I had a virus and bronchitis. I left. I started the medication. This was on a Wednesday. By Friday, I wasn't getting any better, and I was even more weak at this point. So I said to myself, okay, I called my primary care, who with just the symptoms over the phone told me, you need to go to a MedStar unit so they can test you. And I did just that. I went to a MedStar ER, gave them my symptoms. And I also mentioned at that time, I said, it's the weirdest thing. I haven't been able to taste or smell for about 4 or 5 days. Well, the nurses brushed me off. And when I mentioned that I was a hygienist, one of the nurses said, oh, well, I'm a nurse. I have people coughing and sneezing on me all day. That doesn't automatically give you coronavirus. I said, you're right. I said, but I am a hygienist. I haven't been out the country, but I am a hygienist. I'm in people's mouths every day. I said, but I do have the other symptoms. So are you just going to ignore those symptoms? Long story short, they sent me home from that ER. This was a Friday. So Saturday morning, I got a call from the first urgent care that I went to, told me that my chest x-ray came back and it was showing signs of pneumonia. Well, I thought, okay, at this point, with the whole coronavirus starting to really get hyped, I thought, great. All I have is pneumonia. So I was like, that was wonderful to me because now I had an explanation for cough, fever, no taste, no smell. It was weird to me, but at least I had an answer. So that Saturday, and I was smart enough to stay home in bed. At this point, I hadn't worked since March 5th because I was too sick to work. So that Saturday, after I got the pneumonia results, I was still getting worse. My fever was still, it was, I still had a fever. It was getting higher. I was taking Motrin. That wasn't helping. I'm sorry, Marcia.
What date was that? Because I remember you started symptoms on the 5th, but we didn't start talking about it in the dental community until like the 12th to 13th of March. And then it wasn't until a week later where they're like, oh, aerosols maybe will be in the air from what we're doing. So then that's when the dental community pretty much was putting a stop on those elective procedures. But
right.
So when your test results came back, it was like around what time? I mean, the date.
Okay. I was tested March 16th. That was a Monday. Okay. That was my second visit to the ER. I was tested the Saturday that I got the pneumonia call because I wasn't feeling well. 48 hours later, I went to a second ER to say, okay, something is wrong with me besides pneumonia. I'm not leaving here until I'm tested. And I'll be honest with you, was I 100% certain that I had the coronavirus? No, but I knew something else was wrong with me. I knew that I needed to get tested. If nothing more, let's just rule that out. As a hygienist, now I'm on alert. I'm like, I need to know, test me for whatever. So they tested me again for the flu on March 16th at the second ER. And he told me, he said, if the test for the flu comes back negative, I will test you for the coronavirus. And that's what the doctor did. Thank God. And he, gave me another prescription for Augmentin, something stronger, because at that time, they wasn't talking about one of the symptoms being no taste or smell. So he thought that the no taste or smell had something to do with something totally different, totally separate. So he did give me another antibiotic. So I was tested March 16th. And today, what's today? The 26th. Literally 10 days later. I mean, when I tell you all, like I said, I was waiting on the results. I wasn't panicking. I didn't start panicking and getting anxious until 4 days ago when I was watching the Red Table Talk, and this young lady who tested positive with she and 6 of her other friends, she's talking about it. And when I heard her say, it's the weirdest thing, none of us can taste or smell, my anxiety shot through the roof. I mean, I literally was just, I can't even explain to you. I said, oh my God, I have it. Right. I mean, I literally knew at that point, I have it.
So had you been working up to this point? Had you missed any work?
Yeah, I have not worked. I worked March 6th. It was a Friday. And I worked for 3 hours that Friday. And to that 3 hours, I felt like I had worked 10 hours. Wow. That was literally the very next day after the coughing started. I felt like I had worked a 10-hour day in 3 hours. I was down for the count. I was sick, the coughing, the fever, etc.
So they say like a lot of times, like you have the virus before you even start showing symptoms.
Right.
So,
right.
Wow.
That's what I was going to say, Martell.
That was
The
in
fact that
February. That would have been in February if you count back.
there you go. That's what I was getting ready to say. Since
Right.
my symptoms of the coughing started March 5th, I went back 10 to 14 days, and I had to, today, once I found out, I had to call the offices that I had worked at to let them know.
Right.
Now, at this point, because I hadn't worked for anybody since then, so everybody's been fine. Nobody's showing any symptoms, but I did count back, like you said, Martell, to 10 or the 2 weeks to see where I had worked, where I had been, who I had been around. The good thing is I literally work and come home, so I'm not a sociable person. I don't really go out. So at this point, I said I've been nowhere but to work. Because, you know.
Came from like the aerosol, maybe, possibly from.
Right.
Oh my goodness.
I mean, I can say 99.9 with certainty that I got this as a hygienist. And that's okay. I've been doing this a long time. That's the risk that we take. I just thank God because, as I say, while I was waiting for my results and I had to talk myself down from the anxiety of not knowing and calling these people every day, harassing them for my results, I said, okay, Sabrina, you're on the other side of this. Obviously, you're going to beat this. You're at home. I'm sick, but I'm not in the hospital, and I'm not as bad as some of the other people that I have seen on social media and heard, and, you know, some of the other people that I've listened to. But I make no mistake, I have been sick. I have been really sick, and now I'm recovering, and I'm still weak. I still can't, on a scale of 1 to 10, my sense of taste and smell is like at a 2 or 3 today, which thank God, because you know, like I said, it was nothing. I mean, I could literally taste or smell nothing for over 2 weeks.
Oh my goodness.
So when again, I called the office 8 o'clock this morning for my results. They told me to stop calling them because they don't have them. And within 2 hours, she called me back and told me that I had tested positive. And at that point, I knew I was positive. I did. I don't know. I knew I was positive, you know, so.
Did they instruct you to do anything after they gave you those positive results?
She just told me to continue to quarantine, which I have been doing. And, you know, there's no point of, unless you're having a hard time breathing or you're having lung problems or asthma with it, there's no point of coming into the hospital. They stay home, quarantine, and contact anybody that you've come in contact with in the last 2 weeks to let them know.
Sabrina,
but like
how long have you been a hygienist? Pretty much. And how old are you?
Okay.
People want to know. And then if you don't want to tell it,
no, I don't mind. I don't mind. I mean, that's why I'm calling, because I want folks to know, you know. I graduated May 95. So this year May will be 25 years.
Okay.
And I am 49. I will be 50 in August.
Do you have any underlying health conditions that you don't mind disclosing? Any blood pressure, diabetes, anything like that?
I do. I have high blood pressure. It doesn't matter that it's, you know, it's pre-hypertension, but I do take a 5 milligram amlodipine. Other than that, I have to say that when you're talking about a virus like this or respiratory issue, I am healthy. I had a virus in October. That lasted a couple of weeks, and I had a cold in February. So when this started to happen, I thought, oh God, here I go again. Like, my immune system is weak. What is wrong with me? Blah, 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 blah. So, you know, I would say compared to the, you know, other pre-existing conditions that I could have, I don't have anything. That's why they sent me home. That's why they didn't keep me last Monday, because he did say, you know, I'm healthy. There's no reason for me to keep you here. You're more at risk staying here. So he literally wanted to get me out there as soon as he could, out the ER.
So a lot of people, what we see is the worst of the worst. So the media obviously is going to sensationalize the story. So what you see on Facebook and the videos are the people in the hospital with the you know, tubes in
oxygen.
their nose.
Yeah.
So you really don't hear people saying, you know what, I have this. I was walking around with it. I thought it was a common cold or pneumonia, and I'm fine. I was not feeling myself. I was having trouble breathing, but it's not, like I said, it's not a death sentence. So
no, right.
Scare people. I feel like more people need to hear, and I'm so happy that you decided to share with us. More people need to hear people on the other side of it, because when I keep seeing videos, I'm like, I mean, is this all that's out there? And then it really does scare us, which we should take precautions anyway. But like you said, you were exposed to it way back in February, and you had a cold prior to that. But it's just like, you know, the patients coming in that we were seeing, were they coughing? Did they have a cough? Is it like they just have allergies? You know, people say that all the time. Like, oh, okay, it's allergies, but they want their teeth clean, so they're not going to be, you know. So, so it's a lot of different factors, and I'm pretty sure, as a hygienist, being a hygienist for as many years as you have, you did all the PPE, whatever.
Absolutely.
So
I'm the hygienist that, before all of this came about, because when this all came about, I had bottles of Lysol that I purchased from BJ's on a regular. I'm the hygienist that in between patients, I'm spraying my room where, you know, the younger folks, the younger assistants are like, Sabrina, you're always spraying. I literally spray in between my patients with Lysol. I don't just wipe down. So I'm that hygienist that I spray. I went to a temp assignment. They didn't have Lysol in the office. I went to the trunk of my car and got a bottle of Lysol. And I've been doing this, like I said, before the whole coronavirus pandemic.
It's just
so, you know, that's just to show you. And again, the mask, the gloves. I mean, I do everything that I'm supposed to do, and I still got it.
So you feel like our PPE is not enough to offer us adequate protection?
I'm not going to personally say that. I'm just going to say I'm the washer, and I'm the type where, again, using hand sanitizer. They're like, Sabrina, you don't even use hand sanitizer, because I wash my hands. I'm like, and I say, you know, I would tease them. I'm like, I'm old school. I'm like, I didn't come up with this hand sanitizer. I wash my hands. I take my gloves off. I wash my hands. My mask, I don't have my mask. You know, I keep it. I keep it firm around my nose.
But you weren't wearing the N95 mask, so at first they're like, "Okay, you're good with the mask," and then it's like, "Oh no, you need the N95." And you're like, "The N90 what?" And then it's like, okay, are we protected? So it's like we're just fighting something that you probably, and a lot of us probably have either been exposed to.
Right? Absolutely. I mean, honestly, a lot of people, I feel at this point, are walking around asymptomatic. You know, I do. I believe that. I do.
I went to, I was in Florida in February at a conference, and when I came back, I was like, I haven't called Maria, and I was like, I just don't feel good. I'm like, my lymph nodes are swollen. I'm just tired, and I left work, and we were just talking about it, and I went, where did I go to get some Theraflu? She's like, go to Walmart and get some Theraflu, and I did, and then I came home and I started taking echinacea. I was taking like 3 of them. It says it says like take 7 a day, and I was just in echinacea, and then slowly but surely that those lymph nodes started feeling a lot better, and the pain went away. But it was probably some type of viral. And like,
there you go. Absolutely.
Symptomatic. And when I did go to Florida, I was wearing a mask or whatever. But yeah, definitely. It doesn't matter. So it doesn't matter. And I definitely didn't touch my face, but I still had those symptoms. I'm not saying it. But it was some kind of viral, because I felt sick. The third vaccination made me feel better. But Sabrina, I know you're out of work, and I know you make a lot of our Brown Girl sweaters and our shirts and whatnot. So if anybody, and I know you don't want to contaminate that stuff, so you can't even work. I know you.
No, I immediately, again, because of the type of person that I am, I stopped my customer pearl business. You know, I didn't want to give someone their stuff back, contaminated, etc. And I was honest with everybody from the beginning that before I knew that I had corona, I said, you know, I'm sick, I have some type of virus, so I don't want to handle your apparel. You know, I didn't want to do that. So I haven't worked as a hygienist, and I haven't, you know, with my business, you know.
So I want to put a link. I just want to put a link to help support you, and whatever anybody can donate, that would be appreciated. Anything would help. And I know you're not asking for it, but we're gonna do that anyway. So we're gonna put a link up here if anybody wants to donate. And thank you for being brave enough to share your story.
No, thank you. I appreciate that. I was going, you know, I wanted to do this. I wanted to do this for my colleagues, my fellow hygienists, because I feel like everybody has a right to know. There's so much information out there, and you're watching the news and you're thinking, you know, that's somebody in another state. But I wanted to, it's home. It's home for me. And
where do you live, Sabrina?
I'm in Upper Marlboro, Maryland. I'm like 10 minutes from DC. I'm right outside of DC.
So that's like a big travel city. Like there's people
Right.
coming in. You might not
Right.
out of the country, but a lot of people travel for work.
Right. Right. Yeah. It's been very scary. I'll be honest with you. You know, I don't want to put emphasis on the finances and things like that, because as long as you have your health, that's number one. That's what's important. But I'm not going to lie. This is very scary for me. You know, it's very scary. And
it's not cheap up there either.
Right. And nobody knows what's going to happen now if you've been diagnosed with the coronavirus.
Right.
They're going to say, well, now you have to be out of work for 6 months. Like, we
right.
don't know
right.
what's going to happen.
That was another reason I was a little apprehensive, to be honest with you. I said, you know, I try to think of all the repercussions. Should I do this? Shouldn't I? But, you know, I knew, I said it a week ago. I said, if I am positive, I said I was going to go live, but I don't, you know, my appearance is not great right now. And but I did want to, I had to do this. And if I didn't do it, it would have bothered me. And so I wanted to do it. I wanted to put this information out there. And if anybody has any questions, you're more than welcome to ask me. And, but yeah, you'll survive, you know.
You're on the other side of it.
I'm on the other side of it. And that's what I kept. Even while I was waiting on the results, Martell, I said, Sabrina, you're on the other side of it. So I'm just recovering. I'm getting better. And sometimes when I try to push myself too much, and
your body makes you sit down.
People shut me down and like, okay, you're almost 50. Sit down, Sabrina. Okay, you know. So, you know,
you have our support, and you have our support 100% of BrownGirl. You can call me anytime. And I'm sure.
Thank you so much.
I am sure the group members would really appreciate that and support you, because you're family.
Oh,
definitely. So before you go, Sabrina, I just wanted to say that, you know, as you know, everybody is not out of work. A lot of states, they have shut dental offices down, but there are some hygienists that are still out there working.
Oh, really?
Yes. What tips and advice do you have for those who are still working?
Oh, wow.
Yeah, it's unfortunate, but yes, it is true.
Okay, I'm going to speak on this. Strictly for health reasons. I know we all worry about finances and bills, etc., but I'm gonna be honest with you. I don't think that I wouldn't work at this time. I mean, when I found out last Monday or Tuesday, you know, 1 or 2 offices that I know of were still up and running and working, I said to an assistant, I'm like, what are you doing? I mean, this was before my diagnosis. So, again, you can't put a price on your health. I personally wouldn't be working at this time. Like I said, when I say I took all the necessary precautions and I'm the Lysol queen and I'm the wash your hand queen, and I got it. No, it's no, I wouldn't work. I wouldn't work.
Nobody knows your anyone's
Right.
situation.
Absolutely.
You do what you have to do for you, but
yeah.
If there's nobody to take care of you,
yeah.
worth it? No, probably not.
Right. Well, I'm single. I'm divorced. I live alone. I pay all my bills, and it's just me. So I totally get it. I promise you, I get it. Like I'm looking into some resources now. So it's just me, and I totally understand that. But if you're sick and you're not here and you're not able to work,
then what? That's the only thing to take into consideration.
Yes.
I had a girl
Yes.
tell me that her office is making them work. She's a hygienist, work as dental assistants, and she's like, she doesn't know what to do because they don't have the N95 mask. And I'm like, I can't tell you what to do. That your situation, so you gotta just, maybe you sharing your story will help somebody.
Yeah, I get it, and I understand. It's easy for me to say don't work,
right?
But as somebody who's going through this, I'm telling you, of as my friends say, of all the people in the world, but as a hygienist, again, I'm not as surprised as they were, because we have risk for you name it, a lot of things. I mean, our profession is number one for communicable diseases. So,
right. They
need
to, and that goes back to hygienists and healthcare. Like, they really need to start integrating and taking dentistry more serious.
Absolutely.